Joe, you have the other. Huh? You have the other. Okay, and you saw the mute is that tiny little button on the bottom? Yeah. They don't have a power, they have a mute. Yeah, it's just what you do is flip it over to the opposite side. It just turns it off. Just live? Yeah, this is live too. Yeah. I'm trying to figure what's going on here right now. I'm getting sound here, but I'm not getting it off my headset. I didn't know why. You know.
Hey, hi.
Probably more important that I have the camera on that rather than you.
Sure, that's fine.
Right, so
Yeah, I'm on. I'm live.
Okay, we got a minute or so. People are going to be drifting in. I got a couple of administrative tasks here that we want to talk about first, and then we'll get right to Mr. Schulman's, the eminent Mr. Schulman's presentation. First of all, there's refreshments over there. Help yourself. Whatever you'd like. This should go, Cy, what about an hour and a half, 2 hours, depending on questions?
We're going to try to do this quickly in about an hour and a half.
Done.
And
Okay, so that's what your time limit is. The cookies over there, a couple of things I wanted to point out where your dues are going. First of all, to my salary, I'm getting paid triple what Judd got paid. 3 times 0 is still 0. What you'll notice is one of the expenditures we did for this past year was a high-resolution monitor. That's what that is. You're able to capture this much better with our brand-new high-resolution camera. And the high-resolution camera captures the images in low light like this so that the people who are online can see this. And the people who are online are listening to this right now. That went off at about 3 o'clock. And it goes through a private YouTube, and then we store it and put it up online for you to review. If you had any questions about what was discussed, you can go back and see that. Only members. How do you find it? www.ibm sfqccaa.org. Don't listen to Judd. Yeah. Anyway, if you want, I'll give it to you afterward. It's pretty easy. You want me to repeat it? Yeah. There it is, right there. The only thing you need at the bottom after that is .org. All right? Okay, so we've got about 14 or 15 count online reviewing this at the same time, and as I said, it'll be archived on the website. In case you don't know, my name is Greg Cesario. I am the outgoing president of the organization. After 4 years, I thought that was enough, and get some new blood in here and get somebody else to do some stuff. I'll be doing the events between now and the annual meeting, and then slightly after the annual meeting, I'll begin phasing myself out. I don't know who is going to be on the slate for the president. Maybe Juddy has volunteered. However, it's going to be, that'll all be announced at the meeting that Angelo's conducting on the 2nd of December. We've got a lot of other events coming up. We had a lot of very successful events. Did anybody here go to the Delray Playhouse for the Sensual Senator? How was it? Did you like it? Good, okay. Is that something you guys want to do? You like the events like that at the Playhouse and stuff? Yes? Okay. Because we're always looking to cull out the ones that the dogs don't like, the dog food, and put out new stuff so you can try new stuff. But it seems like we got a few tried and true ones that we're sticking with, and then we're adding ones that goes along. One of the other dominant items that is a change coming up is the lifetime membership. Did anybody sign up for a lifetime membership? Wow, 1, 2, 3, 4, 5. Excellent. $100 in-state, $75 out-of-state, never pay tuition again. I'm sorry, dues, member dues again. Apologies about the tuition. My old academia days. So that we're going to try to continue to do stuff like that and offer you more exciting ways to do this so we don't hassle you with payment and you don't have to be bothered with it. And we hope and sincerely wish that you outlive your 5 years worth of membership dues beyond expectations. So that's one. We just instituted that. We got a couple other things coming up that are going to also be pretty exciting, both from an event point of view and from an announcement point of view. I will be attending the next meeting at the annual meeting as the outgoing. Angelo will be conducting it. He's the secretary. That is the normal tradition. We're very healthy in terms of the bank account. We want to do more things for the members and have more events, and we think we're going to be able to do it this next couple of years or this next year or so. And the $100, the lifetime membership is allowing us to maybe get a little bit more aggressive with that. The equipment is a contribution, and all of the people I'd like to thank are the people on the staff that I will thank for at the annual meeting, but the team that's delivering all this stuff to you is fabulous. Excuse me. Angelo, Juddy, who else is here? John Ryan. John is going to be an outgoing officer as well. John has been a treasurer for almost as long as I have been the president, and we figured we've stolen all the money we can, so the answer is we're going to change it out. John is leaving the board as well. We are looking for board volunteers. We could really use your help. Whether that means you want to sit in a board member at large and a non-voting position, or whether you want to hold an officer position, that's fine. We would love to have you, and we need the help. If you want to continue on delivering this stuff, we need the help to get all this done. Fred Getz, who is not here. Julie Goodwin, who is not here. Who else? Who am I missing, John? Jim. Well, Jim's in the back. That's right, Jim DeArmond. All of these folks, believe me, it looks okay when somebody like me gets up here and has a microphone in their hands and can talk for an hour, but it's not me. It's these guys, these men and women that are doing this stuff, that are delivering this stuff for you. And without their dedication, this thing wouldn't be flying like it is, or as popular. Sorry? Oh, Dave Pavick, too. Dave's not here as well. He's another one. Who else? I must have missed somebody else. Oh, Dave Johnson, he's another one. Dave does much more, almost all of those emails, those blasts that you see, Dave and one other volunteer helps do that. And the contribution for that is wonderful as well. Oh, no, Lou is a past secretary, but Lou's not here, but he helps. Matter of fact, Lou brings you the wine tasting. Ooh, now if you haven't attended one of those, you really ought to make it a point of trying one. We don't know, the next one is going to be March the 27th. The 17th is St. Patrick's Day. We got a conflict with the 10th because this Count de Hornley Plaza was booked, so we're going to be doing that on the 27th. But you'll be getting it in the mail. We don't know what the menu is going to be for the wine stuff, but I can guarantee you it's probably more fun than you've had with your clothes on in a while. It really is a lot of fun, and especially when you ask them what direction the train just went and the anesthesia has kicked in and they don't even know that there was a train that went by. So there's some fun times. So I would encourage you to participate. It's probably the best $25 that you'll ever spend. Have a great time of entertainment. We take reservations on tables as well. So if you want to be with a group, it's great. Okay, I think that's the bulk of the administrivia deal that I wanted to share with all of you. But really, we are looking for some volunteers and we need some help. Okay, any questions?
You might have mentioned that.
Oh, the survey. The survey. This is your opportunity, this little green sheet, this is your opportunity to go at the departing president and treasurer about nasty comments that you'd like to make to us. But we'd appreciate you filling this stuff out here and dropping it off in the box or dropping it to us on the way out.
And also anyone who'd like to know more about being an officer or being on the board, please stop by and see us.
Will do. Will do. I didn't leave. I didn't decline to run again because it was a bad position or I didn't enjoy it. What I said was that the organization always can use new blood. Those positions aren't for permanent positions. They are for rotational positions, and that's what we really would like to see. Okay, any other questions? Did I miss anything, gents, ladies? No? Okay, without further ado, Mr. Schulman, Cy has been doing it now. Is this your third year in a row, Cy, or fourth? Fourth year in a row. So Cy, I probably started about the same time Cy started doing this stuff, but I heard from a reliable source that this is it. Am I correct?
This is
This
it.
is it. So this is Cy's swan song in terms of doing it. He'll talk about the changes from this year, from next year to this year, of which there don't appear to be a lot of changes, but that's what rumor is that I've heard, but Cy will confirm all of that. We'll have a Q&A after this. What we will ask is, I will hand you the mic, or I will ask you to repeat the question so that the 14 or 15 people that are online can hear the question. If you just address the question, they can't hear it unless it goes through the mic. Okay? So I'll be wandering around. This should last for about 90 minutes. And without further ado, any questions before that? Yes? Or were you just scratching your head? No? Okay. Mr. Schulman.
Thank you, thank you. We have a particular disclaimer that we start all of these sessions with. I need to tell you that IBM does not call me to give me any special information about benefits. The government doesn't call me. I have available to me exactly the same information that you have available to you, except that I study it and I look at it in detail, and I try to resolve some of the discrepancies, and I try to make sense out of it. But other than that, I have no special insight into the medical benefits or how Medicare works. Okay, to begin, some of you are probably aware that we recently had an election in this country. And I need to sort of set you at ease regarding the results of that election. In other words, our president-elect had insisted that one of his first acts would be the repeal of the Affordable Health Care Act, or Obamacare as it's known, but that has nothing to do with Medicare. That is separate and distinct from Medicare, and whether it gets repealed or not will not affect us in any material way for anybody in this room.
Excuse me a second, Cy. Can everybody hear Cy? Is he at the top close to the microphone? Yes. Thank you.
Okay, thank you. Is that better? Okay, second is that the Republican administration in the White House, and now a Republican-controlled Senate, a Republican-controlled House, have for many, many years threatened or argued for severe modifications to Medicare and to Social Security. And while they may well happen, they too will have almost no effect on those of us in this room. The changes that have been proposed would require that people would have to work longer before they could collect Social Security. They would have to be older before they can start receiving Medicare, they would have to pay into the system for a higher proportion of their wages than they currently pay today. So the effect on us will be little to none. The effect on our children and our grandchildren will be substantially higher. But for us, it's not something we should lose any sleep over. Okay, having said that, let me just give thanks where thanks is due. There is a lot of help that comes out of the IBM Tampa Bay Retirees Organization, especially from Harry Aurora. And these people do a lot of work, and I do a lot of work, and together this presentation exists as a consequence of that. Now we're going to see if this works. Okay, this is our agenda. It's a big agenda. I show it to you. I'll be relatively silent. Just read it, and you pick out the points that you're not interested in, and you can either go for food, go take a nap, or whatever. But this way you can schedule your okay. All right, so what have been the changes from 2016 to 2017? Part A costs go up a little bit, 2 to 3%. The Part B goes up also a little bit, 10%. Typically, you're going to pay more money in the form of surcharges if you're a higher income individual. And the adjustments, what you pay in 2017 is going to be based on your adjusted gross income for 2015, because that's the most current information that the government has about you is your 2015 tax return that you filed by April of this year. Now, if material changes have occurred, if, for example, you were working in 2015 but are now retired so that your income is expected to be substantially less, you can get the surcharges reduced. All you have to do is you call your Social Security Administration, you make an appointment to visit them, you ask them what forms you need to bring with you, you bring the forms, and they will reset your adjustment to a lower number. If this meeting doesn't take place until sometime next year, the adjustment will be retroactive. So don't worry about having to do it before the end of the year. If you don't get to it until March of next year, they'll give you credit for the first 3 months. Okay, Part A covers inpatient hospitalization. You're enrolled automatically the month that you reach age 65. There's now a $1,300 some odd deductible for the first 60 days, additional deductibles after that. What it covers, you pay some, it pays some. Part B pays for doctors and hospitals and outpatient services. There's also an annual deductible. Medicare typically covers 80% of the bill. The other 20% is up to you. And that's why we have this meeting, is for how you want to get the other 20% covered or paid for. The minimum payment is $109 a month for Part B. That comes directly out of your Social Security check. Last year it was $104.90, $105, so it's gone up a small amount. Surcharges go up with your income, and each bracket, we'll see what the brackets are later, is increased by approximately 10%. If you retired prior to 1997, on or before December 31st, 1996, you are entitled to something called SHAP, which is $900 per employee refund of your Part B premiums. You file a separate form for that. Most of you should know what it is. If you don't, come talk to me. I'll explain it to you. But in order to get that, you have to pay a Part B premium. You could be married, you could be single, you could be divorced, you could be a Mormon and have 7 wives. We don't care. IBM will give you $900 per employee. Medicare Part D pays for drugs. We purchased that through One Exchange. The drugs are up to, before you reach $3,700, you're what's called in the initial stage. And then you reach a stage called the gap, where coverage is less. You pay more money for drugs in the gap. And then when you finally spend enough money that you're out of the gap, you go into what's called catastrophic coverage, and you pay considerably less. In 2017, while you're in the gap, you'll get a 60% discount on brand name drugs, 49% discount on generics. And by 2020, the discounts will increase until the gap disappears. So part of the legislation that created Medicare Part D was structured in such a way that there is no gap from 2020 onward. If you find yourself entering the gap, if your drug costs are substantially high, if you take a lot of meds and you're in the gap, I suggest to you that for generic meds, where your discount is the lowest, you should price them at Costco. And you may find that you can get drugs at Costco without insurance cheaper than you can through your insurer. I have 2 drugs that I take myself where I get them cheaper at Costco than I do for my insurer. Okay, so here we're talking about the surcharges. So if you are married, say, and your combined income is below 170,000 or 85K for an individual, you pay the minimum amount in 2017. You pay $109, and you have no surcharge for your drug plan, for your Part D drug plan. If your income is higher, 85K to 107K for an individual, up to 214,000 for a married couple, you pay a surcharge of $187.50, up from $109 to $187.50. And finally, if you're really in the stratosphere income-wise, your surcharge can be as high as $428. And in addition, you'll pay another $76 over and above the published price for your Part D drug plan. So again, the prices, the surcharges increase with increased income.
So if you're married and filing jointly, and you have a surcharge, both the husband and the wife pay the surcharge?
Yes, yes, because it's, Now, again, what I mentioned to you before, if conditions have changed, I mean, remember, this is based on your 2015 tax return. If conditions have changed dramatically in your favor, I mean, don't do anything if conditions have changed the other way, but if they've changed in your favor, call Social Security, make an appointment to see them, ask them what documents they need, and your surcharge can be substantially reduced.
Side,
Yeah,
is those surcharges deducted from your social?
yes, they're deducted right from your Social Security check. Okay, there are a group of plans called Medicare Advantage plans, sometimes called Medicare Complete. These are all-in-one plans. These plans include medical coverage. They provide for hospitalization. They provide for doctor payments, and they also include drug coverage. They come in two flavors. There are HMO type plans, which are the most restrictive in that you have to get your medical care from within a specified network. Some plans are PPOs, which are somewhat less restrictive, but nevertheless restrictive anyway, where you can sometimes go outside of network to see a specialist, but you do that usually at additional cost. In a PPO type plan, you don't have to identify a primary care physician, so you don't need referrals. You can use out-of-network providers, but you're going to be paying for that.
Sorry.
Yeah.
Is there some standard amount for the higher cost for out-of-network? Or is it just every individual insured?
Okay, I'm not sure. Is there some standard amount for?
The out-of-network extra higher cost?
It varies, but it's usually for these type of plans in the 5 to 7K range. If you go out, and for in-network and for out-of-network, it's $10,000. Typically for the plans available to us, it's there's a $10,000 maximum that the exposure that you would have for going on a network. We have Medicare supplement plans. These are also referred to as Medigap plans. Over here, the supplement coverage is not provided by Medicare. Medicare provides your base coverage, and then you purchase additional coverage from an insurance company, which is your secondary insurer, not primary. You have to enroll in Medicare Part A and Part B, but you retain your Medicare privileges, so to speak. You don't assign them to an insurance company. And in these plans, you'll have to enroll separately in a street drug plan.
Can you take a minute and give your thoughts concerning the two different types and who might like the first
Yeah,
plan versus the supplement?
I will. If you can wait about 3 or 4 charts, I'll do that. I'll have it. Okay. All right. After 2013, IBM essentially got out of the medical benefits business. They turned it over to a company called One Exchange, Towers Watson, whatever the name is today. And essentially, we now deal with them for all of our medical benefit issues. We have to work with One Exchange in order to select a medical plan. We no longer have group plans available to us. That's an advantage for husbands and wives, because in the past, under a group plan, both husband and wife had to be enrolled in the same plan. Now you can select a plan based on individual needs, but it does mean that both of you have to enroll. In the past, the IBM employee enrolled and the family was covered as part of that enrollment. Now you, husband and wife, have to enroll separately. Okay, One Exchange, they're the largest private Medicare exchange. They serve over 500,000 clients, and by proclamation from IBM, they are our interface for selecting a medical plan. So the way it works is that IBM has set up an account under this notion called the health reimbursement arrangement. They've set up an account for us that to pay for eligible out-of-pocket expenses. Probably for most of us in the room, the account is $3,000 a year. Some people who retired earlier than I retired get $3,500 a year. And that's money that you were able to draw from to cover your medical expenses for the year. It's use it or lose it. Unlike the past, when the coverage was pooled, if you didn't use it and somebody else did, that was fine. But now, if you don't use your full allocation, it reverts to IBM. So use it or lose it.
You still have to take the regular medical coverage to get the vision and all that.
You have to take at least a medical or a prescription or one prescription drug plan from One Exchange in order to be able to tap your HRA. There's an exception for certain veterans, but that's about it. For the rest of us, we have to have at least one plan. So if you're husband and wife, only one of you needs to have one plan, a Part D drug plan or a medical plan with One Exchange in order to gain access to the health reimbursement account.
Excuse me, Cy.
Yes.
I would like to ask anybody in the room here, if you got a question, raise your hand so we can get the microphone to you so our remote viewers can hear the question. Thanks.
Okay. I just want to call your attention to one of the lines here. If you and your spouse are both IBM employees, you're both eligible for this account. You have an option to combine it or to keep them separate. Unless you absolutely hate each other, you're better off combining them, because that way you benefit from the pooling of the account. And if one of you is very healthy and one of you is very sick, great. That it'll work out. It'll work out better than if you had separate accounts. Okay. I can pretty much let you read this, but it's kind of simple. You pay first, and then you get reimbursed by One Exchange, by Towers Watson. So if you can arrange for them some of the plans that you take, they can automatically make deductions and payments for you, in which case they will automatically send you reimbursements, usually a month or 6 weeks later. If you don't enroll for programs like that, then you have to collect receipts, periodically mail them in to One Exchange, and they will reimburse you that way.
Is there any thought to?
I've noticed a trend the last few years that insurance policies keep increasing every year, but the bucket stays the same. Is there any thought of considering time value of money by the corporation for the bucket with maybe a cost of living or an inflation indicator or something?
From your mouth to God's ears, right? I don't think there's a snowball's chance in hell that IBM will do any more for its retirees than they're currently doing. And that's my reading of the deal. That's why they are now at arm's length. You can't even talk to IBM anymore about benefits. You either talk to somebody at Fidelity or somebody at Towers Watson. There's just no longer an IBM interface to complain to or to plead with. So I agree with you. It used to be that from time to time, IBM would look at the money that they have in the retirement accounts and say, wow, this is really overfunded, and therefore they would parcel out some more to the retirees. I think our last bump was many, many years ago. And part of the reason for that, for those of you who aren't aware of it, is that when Lou Gerstner became the CEO of IBM, I'm not saying he did a bad job for IBM. I think he did a necessary job, but they decided to pay their embellished benefits, their retiree benefits, out of the surplus that existed in our accounts. So the IBM accounts had a surplus, but now everybody's getting, everybody, I mean the top levels of the business, I guess in order to attract and retain key talent, were being offered substantially greater retirement benefits than you and I were offered, and that was paid out of the surplus in our accounts. So that's why things are how they are. Okay, we covered this, but in order to get your money, you have to have at least one attachment to One Exchange. You or your spouse has to have either a medical plan or a Part D drug plan. If you got one of those, then you can access the entirety of your health reimbursement account. In blue at the bottom, if you are eligible for SHAP, if you, and the great majority of those of us in this room are, you have to make sure that you collect that first before you try to get any reimbursement from One Exchange because you can't collect both ways. The system will stop you in your tracks. So this is an extra $900 a year if you go for it first. If you try to claim this from One Exchange, IBM won't pay you. So. Okay, so this is how the subsidy works. I got so many remotes here. Okay, if you retired before 1992, you get $3,500 in your account, $3,000 if you retired after. If you don't take this new, in the past, before IBM went to this system, a surviving spouse was covered. A surviving spouse got health insurance. Now, it only happens if you pay for it. So if you don't pay for it at your death, surviving spouse gets $0. If you do pay for it, then your benefit is reduced, in this case to $2,600, in my case to $2,374, but upon death, the surviving spouse would collect something. So that's something that changed a couple of years ago, that we now have a third party, an insurance company, actually offering this coverage. If you are new to this program, if you're just coming into this program this year, the default option is spousal coverage, even if you don't have a spouse. So if you are single and you don't require spousal coverage, just make sure that One Exchange knows, or you're going to be paying for it. Okay, I'm not trying to break up any marriages here, but here's how you should think about this. If you are really ill, such that you seriously doubt you're going to make it to next year's meeting or the one after that, you should take the deal. I mean, the coverage is worthwhile. So it's going to cost you $600, but your spouse will collect a lot more than that. If your spouse is seriously ill, you should consider not taking the deal. You'd be better off spending the $674 on making your spouse's life as more comfortable as possible, because the money is just going to be thrown away. If you are 95 years old and your spouse is 22, I mean, God bless you, but even if you're feeling lucky, you should take the deal, right? If, on the other hand, your spouse is much older than you are, then maybe you shouldn't take the deal. And finally, if it's a toss-up, if it's not really crystal clear one way or the other, you could hedge your bet with term insurance. And for the $600 and some odd that this would cost you, you could probably buy a $25,000 term insurance policy that will give you better coverage than the $1,100 some odd a year that it will pay towards your spouse's medical benefits. Work. Okay, I spent a lot more time on this page in previous years, but I'm going to try and do it without too much fanfare now. this HRA deal, IBM getting out of the benefits business, in that it doesn't help us at all. It hurts us. It eliminated the notion of a community chest to cover benefits that in the past, in my group, say the $3,000 group, IBM put $3,000 per group member into a community chest, and it was spent according to the needs of the individual. If somebody spent only $200 and somebody spent $10,000, that was covered. It was all covered in the pool. Now it's not. Now everybody gets a bucket with $3,000 in it. If you only spend $200, then IBM gets back $2,800. If you spend $10,000, IBM just pays you $3,000. So IBM benefits and we lose. Also, the second feature is that in the past, the surviving spouse was covered, that they got insurance. Now they don't get insurance unless we pay for it out of the $3,000 that we get. So, who comes out ahead? You're single, you come out a little better under this plan than you did before. Everybody else loses. Everyone else loses. Okay, I made this chart for the first time last year, and I didn't update it for this year because everything is relatively the same. It's just going to change by a few dollars. So for a guy who is 74 years old, living in Boca Raton, Florida, having a Florida Blue Plan F, that's what this is based on. He paid $314.70 last year. If he lived in Austin, Texas, he would have paid $183. So for the privilege of living in Boca Raton, you have to pay 72% more than you would if you lived in Austin, Texas. If you lived in Tampa, $221.
Quick question. This is what gets paid to Florida Blue
Yes.
in addition to what's paid to Social Security.
Yes, right. Is not paid through Social Security. This is right. This is your premium for your Medicare supplement plan. In Tampa, $221. $222 in Atlanta, right? $200 in Raleigh, $238 in Wilmington, Delaware, $314 in Poughkeepsie, $243 in Westport, Connecticut. I mean, it's, we are in 236 in Scottsdale, Arizona, 246 in LA, 246 in Denver, Colorado. We are in the most expensive medical section of the country there is. It's partly because we have a substantial difference between our seasonal population and our year-round population, that we need to have a medical infrastructure that can cater to the fact that our seasonal population is double what it is for the rest of the year. So we need double hospital beds. We need double the number of doctors, double this, double that. So we pay substantially more for the privilege of living here than we would if we lived somewhere else. Greg.
Let me clarify some of this to give you the accuracy of size chart. I probably in here am probably unique because I am not a retiree and I am single. So I'll tell you what my number is, and I have a supplement plan, just what Cy was talking about. Between the Social Security and, I'm sorry, the Medicare and the supplement, my number I got in the mail yesterday was $312 a month. So that number of 314, that's pretty close.
Yeah.
So the relative change, now that did go up for me this year, under 300. I'm what?
Mine is 330, how are 312? Is that number?
Are you 330 apiece?
330.
Right, and that's what I am for 2017. I mentioned at the beginning that I didn't redo the chart. I showed it for the first time last year. I didn't think it was worth the time and effort to redo it because the numbers will still be relatively, that's the point. I'm just trying to make a point of relative costs, not absolute costs.
But I suspect the difference maybe between you and me in terms of I have Medicare and I have Blue Cross Blue Shield. It may be your other provider. Blue Cross Blue Shield as well?
Yeah.
No, I got the same letter. Mine was 312. I don't know, 72?
Yeah, you're younger, Greg. This is
I
for
don't know.
someone older.
Is there any plan to change the 3,000 or 3,500?
The question is there any plan to change the 3,000 or the 3,500?
No. Like I said earlier, I think not a snowball's chance in hell because IBM has kind of pushed us aside and they don't want to deal with us anymore. So we either deal with Fidelity or we deal with Towers Watson.
I thought that would help in terms of some calibration of the accuracy
Right.
of his chart. Even whether it's 315 or whether it's 330, the answer is, maybe that's age, maybe that's the county that you're in, I don't know what it is, but to me, that would still be relatively close enough. Now, if somebody said it was 450 or 400, then I'd say there was an issue. But when you're within, what, 10%? I don't know.
Yeah, it's my number for next year is the same as yours. I mean, the prices are fixed. They don't differentiate. So I'm at the same $330.30. I think that's what it was. Is that what your letter says?
Sorry,
Yes.
point of clarification.
Yeah.
That 314,
Yeah.
that's your supplemental price?
Yes.
Okay,
For last year.
I think he was talking about his total price.
No, it's the same. That's my total price.
Were you talking about supplemental?
I was talking about the total price.
See, he was talking about total price.
It is my total price.
Wait, wait,
That's my total price.
I just asked you if that was your supplemental price.
Yes, which is my total.
You
I
have to
pay no
for
more.
Medicare also.
No, I don't. I get Medicare and I pay.
You pay a premium for Medicare.
No, I have deductibles.
Well, it's the same thing.
No, it's not a premium. It's I have a deductible.
What?
For Part B.
Wait a minute. You have to pay a premium for Medicare B.
Yes,
Okay, that,
and I have to pay a monthly surcharge and
yeah, the
stuff like that.
314 doesn't
Right.
include that.
No, it's only the cost
my
of my
point.
supplement.
That's
Yes.
my point. He's including that.
Yes.
He's including the Medicare B. Okay, so his amount of 312 is much less than yours because he included the Medicare B. If he takes out the Medicare B and he just does the supplement, there's a big difference.
Well, what is your plan?
He brings a valid point up, and I'm thinking about now what my number was. I have the letter from
Yeah.
this gentleman back here, and this comes directly from Florida Blue. So he brings a valid point up. Now, I think maybe I only see one deduction out of my checking account.
Right.
It doesn't matter to me. And now I think about it, I was probably close to $400 a month before, which means I'm a little higher now. So what that means is your point is Medicare is not in here.
Right,
That's
because,
what your point is. That's what I suspected.
because that deduction came out of your social security check. Right?
I hope
Yeah,
that clarifies
you're
it, but he maybe brings a valid point up. I look at it because I saw the letter of 312 or 330, and then the other answer is, I see it come out of the account. It is what it is. I mean, I just pay it, right? Okay.
In any event, just to expand on that point, what comes out of your social security check has nothing to do with where you live. It's the same whether you live in Austin, Texas, or if you live in Boca Raton, Florida. So it's the variable part that we're addressing here. This is what the supplement costs, and that varies by where you live. Okay, whoops. Oh, we really skipped a lot. Okay, now we know we're going the wrong way. All right. All right, so what we're going to do now and until the end of the presentation is we're going to try to work through a process that's going to guide you to select the best medical plan that you can for your particular set of circumstances. And it will be intended to make best use of the funds available to you from the HRA and from SHAP. Well, all right. So Medicare is available to us in two primary flavors. There's original Medicare and there's something called Medicare Advantage. We're going to take this loop first. In the Medicare Advantage plans, they come in either the form of an HMO or a PPO. These are the most restrictive. They combine Parts A, Parts B, and usually a drug plan. If not, you can get a drug plan separately. And if you join a Medicare Advantage plan, you don't need and you can't simultaneously be in a Medicare supplement plan. The other flavor is the original Medicare, which pays for hospital insurance, medical insurance, but doesn't pay 100%. And then in addition to that, you have to purchase a prescription drug plan. And then you have to decide that since 100% is not paid for up here, do I want a Medicare supplement insurance policy that will pay for those charges that Medicare doesn't reimburse? What's important to note is that this side here is completely flexible. You can go to any doctor, any facility. In this side here, with HMOs, you can only go within the network. Within PPOs, you're primarily restricted to a network, but for additional monies, you can go out of network. Okay, now it's not working. Working again. All right. So what are the types of plans that we have? In the Medicare Advantage plans, as I said, PPOs, HMOs, here you have turned over your Medicare benefits rights to a third party, to an insurance company. So if you're in one of these plans, Medicare does not want to hear from you. They don't want to know if you're unhappy or if you deal with an insurance company. It's pretty much pay as you go. The premiums on this side are relatively low, sometimes very low, zero. But every time you seek medical attention, you will have a copay or co-insurance. The plans do have a maximum out-of-pocket limit for non-drug expenses. You work through networks in the case of HMOs, even PPOs, and with HMOs, you have to have a primary care physician who is the one who will refer you to all the specialists you may need. You're only entitled to emergency coverage when you're out of network. So if you're visiting somebody and you get hit by a truck and it's outside your network, emergency treatment is covered for you. On this side, this is Medigap, Medicare supplement plans. They have different names, which are letters. There's a Plan C, a Plan F, Plan N. And whoever you get that plan from, they all provide exactly the same coverage. So there might be a $2 or $3 or $5 difference in premium charged, but the coverage by law is identical. Everybody's Plan F has the same coverage. Here you pay up front. You pay a higher premium, monthly premium, than in these plans. But in the case of Plan F, which I have, I don't pay anything else. That's it. So if the worst thing happened to me medically, I pay nothing additional. I can see any doctor, go to any hospital, have any surgery. My premiums, my $330.30 monthly premium covers everything. And the benefits are portable if I'm in another state. In fact, in my plan, even if I'm in another country, I have a $250 deductible, and then my plan will pay 80%. So I recommend to those of you who travel, even if you have one of these types of plans, you should always get evacuation insurance, because if you're in a foreign country and you need to be brought back here, that could cost $200,000. Don't know why, but it can cost $200,000 for them to bring you back on a stretcher in an airplane, somebody holding an IV and getting you to a hospital here. So just if you do a lot of foreign travel, just get trip insurance that includes something called evacuation. Greg.
Let me give you the magnitude of the idea of these two plans. Prior to getting sick, I got sick in June of 15. And when I was diagnosed, I was on a Medicare Advantage program. I can remember going down to the University of Miami, doing all the stuff I was doing and the bone marrow biopsies and all the rest of it. I was paying out a pile of money. I mean, the bone marrow biopsies are $4,000 a clip to begin with, and I did 5 of them. I can also tell you that the actual transplant, the bone marrow transplant, was, are you ready? 750 grand. So now maybe you'll have a newfound respect for me as being worth a lot more than you think I am at 750 grand. Plus, I had a bunch of out of pocket, but not after I went on the Medigap or the Part F plan. Once I hit that Part F plan, Nothing. Everybody said, come on in. I said, we'll go to the checkout office for payment. No, you don't need to do that. Just, we'll see you at the next appointment. So you got to balance this thing out. Now, this year, I gave considerable thought process about going back to the Medicare Advantage because I'm staring at $5,000 on the left-hand column, and I think the right-hand column is probably going to be maybe 3,400, 3,500. So there's a big difference between the two. So I said one more year until I get the cure declaration, I was going to stay on option one. But you're not talking about a little bit of money between these two plans. It's a lot of money. That first guy on the left, and now for me, is up close to $5,000. The guy on the right for me would probably be about 33, 34. So it's, and I'm sharing that with you not to share my medical history nor my expenses nearly as much as I'm sharing with you about I don't have an IBM underwriting me where I have a budget that I can pay for at the end of the year. This is all out of my pocket. This is net. So I'm just sharing with you that if you want to walk away and you want to have it all paid for up front, the one on the left is a pretty sweet plan. I don't like the $5,000 a year, but it's pretty sweet. So at the end of this year, in the end of 2017, depending on what my cure is or my declaration of cure, I probably will switch over to the Medicare Advantage plan again. But who knows? That's the luxury of being able to make these decisions once a year. Yeah. Well, you had your hand up, unless you got to go to the bathroom.
My question is, you said you started off with your problems with the Advantage plan.
I did.
And then you switched.
December 7th came along. The renewal period came along.
Was it easy for you to switch?
Oh, it's a snap. They love the more money. It's a delight for them. You just copy the old plan over and say, okay, now you're paying Medicare, and it's a Medicare plan with a supplement. It's a snap. I'll find out about going in the other direction if I change this next year, but I can just tell you, going from the Advantage plan to the other one, it's a snap. Me?
Yeah, we're at the $5,000 versus the $3,300 that you reference as full costs. In other words, on the right, it's out-of-pocket copay.
Yeah, I have no copays virtually on the other one. Occasionally, I'll pay for scripts, and they're $10, $15. I never see ones, and I'm taking my drugs that I'm taking aren't street drugs. My stuff these are exotic drugs just for me. You don't want to enjoy yourself on these drugs. All I'm saying is I don't get to pay. Some of them get to be a big number, and some of them get disallowed. The really high, sophisticated ones, they challenge, but I have yet to have one that's unpaid.
My question on the right, though, is I thought I heard somebody say there's a maximum out-of-pocket on the right.
Yes,
Yes.
there is.
That's what I heard.
Yeah, I'll show you that.
The donut hole applies to me in this thing on the left-hand side, but that donut hole, in terms of what the ongoing, every time you renew the script costs for the right, are significantly lower than the other. So it takes you longer to get through to the donut hole or out of the donut hole.
The maximum out of pocket does not include drugs for Medicare Advantage plans, nor for Medicare supplement plans. It does not include drugs.
So the $700,000 would be capped over $10,000.
Yes.
There's one more item on the option one against option two, and that is, there's a lot more paperwork with option two. Option one, no paperwork.
Okay, you're saying option one, the one on the left.
Yeah.
Yeah, I agree. And by the way, that was one of my requirements is at this point in my life, I don't want to waste any time filling out forms. I'd rather be out on a golf course.
I thought there was a problem going from option two to option one.
There is.
Problem being existing conditions.
Yes, there is a problem. I mean, Greg might have gotten lucky, or I don't know, but if you turn down the left side at the time you first become eligible, if when you first become eligible for a Medicare supplement plan, that is when you first enter Medicare or when you first are dropped from an employer group plan. So when that event happens, you have a one-time opportunity to pick a Medigap plan without going through underwriting. At all other times, if you want to opt for a Medigap plan, you may have to go through underwriting, and if you have serious issues, they may reject you. So I'm glad you were accepted, but it's not automatically done. It's
When I was accepted to the Plan F part, column one, the left,
right.
they knew I had leukemia. There wasn't any doubt. It had already been diagnosed in the middle of the year, and all I did was fill out the application and said I'm going from Florida Blue Advantage to Florida Blue F or Medicare, the whatever you
Same company.
Right.
The answer is same company. The answer was there was no blinking.
Yeah.
Yeah. Well, the reason I
Well,
asked,
Florida Blue and United Healthcare are the two insurers that are available to us that will allow you to switch plans within.
well, the reason I asked is because my wife is currently on Humana with a 0 premium, and all of the doctors and hospitals that she uses are being dropped. So she wants to go to an F plan, but she's concerned, whether it's easy to do. That was the reason I asked about
Right.
the situation. The other thing I wanted to mention is he was talking about having leukemia and everything. I am a heart transplant. And I got to tell you, F is great because
Absolutely.
I had hospital costs that were over $1 million that I never saw.
Right.
It's great.
I have advocated for Plan F since I first started giving these presentations, but I realize it's pricey, and if you're in good health, you may think it's too much to pay. But the one thing I just want to point out is that if you are in a low-cost plan and you're happy with it, don't let me talk you out of it. If you're happy with the plan, great, stick with it. But if you're asking for advice on how you should look at these things, I personally believe you're much better off on the left side here than you are on the right.
Now you have two people to respect because you got a couple of $1 million men in here, him and me. Him for a different reason than me. But I can tell you when I walked in with the bill from Florida Blue, I showed the gross number to the transplant doctor, the bone marrow transplant doctor, and he was blown away. He said he wanted to quit doing that and go into his own practice. I said, you're out of your ever-loving mind because there's so much overhead with this crap that you'll get eaten up by costs. So he looked into it. He said, yeah, he came back to me one day. He said, yeah, you're right. But I'm just telling you, when you see that bill, Florida Blue knew what I was going to get for a bill because there's only a few places you can go bone marrow transplants, and I'm sure there's only a few places you can go heart transplant. So, they knew what was in front of them with the pre-existing condition. That was my only point. A question came from back here that says, Cy, he thinks you know the answer to this. Florida Blue is the one that we've been talking about only because of my experience in his letter. Is United Healthcare in the area for that? Do they offer a plan for Dade, Palm, and Broward as well, or no? Do you know?
You're talking about, do they offer a Medigap plan?
Yes.
Yeah, of course they do.
Is there anybody else?
Yes, there are many carriers. Aetna, there are a lot of carriers. However, I tried to say earlier that a Plan F plan from anybody is the same. They're all the same. They give you exactly the same coverage. They only.
Yeah, would it be appropriate to switch?
Yes, they could be slightly different in premium. The people you talk to, some might be easier to deal with than others, but the coverage is exactly the same.
The question is then after this was, would it be appropriate to switch if you have, let's say in his example, Perspective coming up Florida Blue, to switch to United or Aetna? Well, my answer would be, Cy just said that they all offer you the same thing. Now, is the cost the same, Cy?
They're within a few dollars.
Okay.
They're within a few bucks.
For a couple bucks, I'd say no.
Yeah, I don't think it's worth. Now,
I'd say for no.
where it might be worth it is if you had bad customer service, if you had, an issue or a question and the phone rings and rings and nobody, okay, fine, then switch. But you're not going to switch for cost because they are virtually the same. The coverage is identical. By law, it's identical. Your doctors they don't care who your secondary insurer is. They only care that your primary insurer is Medicare. Oh, by the way, one other point. A lot of doctors will tell you goodbye if you have a Medicare Advantage plan. My doctor, my primary care, my internist, has had a sign in his office since 2012 saying, we do not accept any Medicare Advantage plans. So if you are in a plan like that, you must always check to see that the physicians that you care about are still in that plan.
That doesn't help.
Well,
My wife did exactly that, checked, and as soon as she got into the plan, they dropped it.
yeah, I know.
Dropped the hospitals. That's Humana.
On that line, the fear for Medicare Advantage plans always seems to be, I'm going to get a bum doctor. I'm just curious as to how many people here use Medicare Advantage and are happy with their doctors.
Right?
Oh, sorry.
Yeah, that's fine. I don't think the fear is that you're going to get a bad doctor. I think the fear is that you're not sure your doctor will continue in the plan. I think that's the fear, is that on this side, stability is never an issue, right? As long as the doctor maintains his practice, you could see him.
Yeah, how qualified are the doctors on the right side? Years ago, it used to be they're less qualified. These days,
I would say that I would be very reluctant to think that they are less qualified. I think usually the ones who work for HMOs are maybe right out of school, may not have enough money to start their own practice, may want to, work for an employer, so to speak, for a number of years, gain a following, and then leave and start their own practice.
I belong to PPO Advantage.
Right.
They give you a book that's this thick with doctors. It's primary doctors, they probably have 500 of them.
The book is out of date the minute they print it.
Well, I mean, but I will tell you that there's just about every doctor that's in the regional hospital in Boca Hospital is in that book and practices, for the PPO Advantage.
I think for a local statement, Hal, you're absolutely correct. But remember, there's lots of folks that don't have the advantage locally that we have. I can share with you, I've been on both of those plans, and I didn't see any difference with the doctors. But that may be unique to being in this area. But I know when I went to Miami for my transplant, the answer was that's out of the network, and they wanted to know why I was going there. And I said, well, it's either over to Tampa to Moffitt, or it's up to Shands up in Orlando. The only place you can go for those things.
But there's still PPO, and so there isn't you go to the doctor, $10,000.
Exactly, exactly.
That was the first one.
Hold on. I'll repeat it because we wanted the people to hear what you have to say. Or unless you want this.
No, you do.
Okay. Thanks, Hal.
Okay, the other thing is, Si, that on the Advantage, I have done one piece of paperwork, okay, once a year for the last 3 years on the Advantage. I fill out the beginning of the year all my premiums. I send it to them, and every month I get a check for all the premiums that total more than the $3,500. So I don't have any paperwork.
Do you have a higher premium Advantage plan? I mean,
No.
what's the premium?
I mean, I'm sorry. I put all my premiums for
Oh, the
dental, long-term care, whatever it is, and it totals more than the amount necessary.
So you do that at the end of the year.
I do it at the beginning of the year.
So they pay you in advance?
They pay me every month. They allow you to separate it, say, this is what I pay monthly, and then they pay it back to me monthly.
So do they pay your premiums?
They pay it to me. I pay.
No, okay.
I pay my
You
premiums
pay your premiums and then they,
through my checking account or through my credit card or whatever the case may be. But everybody pays through their credit card or something.
Right.
Yeah. But the additional paperwork is once a year.
Look at the premium for Blue Cross Blue Shield PPO.
It's very minimal. It's I think,
so you,
I don't recall, but it's almost zero.
what do you do with copays?
I pay them when I go to the doctor. I give them my credit card.
Okay, so you don't have to submit copays because your premiums make up your
Make up
300.
for everything.
Yeah, that's true in my case too. My premiums make up for everything, so I don't have to do anything.
It's not a big deal.
Did you know, my wife just got a letter that said Humana PPO. It just dropped over John Beach.
Yes. Everybody in Humana got that letter.
Dolores has a question.
My question is about underwriting. To
Yeah.
switch back and forth, is there a different carrier or that is just going to be subject, or all carriers are going to be subject to underwriting if you switch back and forth?
If you switch within the Florida Blue family or the United Healthcare family in Florida, you can avoid going through underwriting. If you switch from other insurers, Humana, for example, you do go through underwriting. Now, having said that, not everybody who goes through underwriting is rejected. It's just you stand the chance of being rejected. And I think if you have serious medical conditions, you're more likely to be rejected.
Yeah, however, Greg, you didn't get rejected. And you
No, but Greg stayed within the family.
You asked a different question. Your question was, if I go to Aetna to Blue or Blue to United Healthcare, that is what I heard your question to be.
Okay.
But I didn't change. It was literally a no-brainer going from the left column to the right column. The right column to the left column.
I have AARP with United, so I could do the same thing.
You could do it within United. You can do it within United.
I can switch back and forth between carriers and not have to go through underwriting.
Okay, I'm not sure about the back and forth. I think you can switch. I don't know how many times they'll allow you to do it.
Once a year.
I'm not sure. I'm not sure they would be that liberal. I think they would allow you to switch, but I don't know if you could do that every year.
There's a question here.
We had an interesting experience. We are snowbirds, or we were snowbirds last year, and we became permanent Floridians last year. We were under the Plan F United Healthcare in New York, and then when we became permanent in Florida, they moved their address to Florida, and the premiums jumped 58%.
Yeah.
I mean, it has a lot to do, my size chart around for the map of the country, has a lot to do with where you live. Believe me, it does. But the key is it's portable and you didn't have to start all over again. You could have started all over again, or maybe you couldn't have with other kinds of plans. Just as for my edification, how many people are on option 1 in that left-hand column? Wow. Okay. Well, I'm preaching to the choir then. You guys know just how how much benefit there is to that versus the right-hand side. And I can tell you, if you get really sick, you're going to love the left. You won't love the right in this case. And I don't mean that politically.
That's it. I mean, I'm paying for N, but I'm not saying.
Well, then I would stay over on the right. As long as you're not sick, stay on the right. The only risk you have is that you'll get sick early on in the subscription period, and you'll have to wait till the renewal period to change.
But then I might be subject to underwriting.
You might be what?
Subject to underwriting.
You might be, but it's tough to fall off the floor, right? If you know you're sick, and the answer is it's a done deal, so whether you stay with the one on the right or you're ineligible for the one on the left, you got what you got.
Right, and so therefore you stick with the one on the left and just pay extra just so you avoid that possibility.
You could, if that's your mentality to not want to have to worry. My answer is I'll stay on the right until I get sick, as long as I know Florida Blue has it, and then I could go over to the other one.
As long as you're sure that there will always do.
Yes. That's the question I would ask first, before I started asking the underwriting question. Can I go from 2 to 1 and 1 to 2? Yeah. Sorry. I'm sorry, Angela?
Yeah, again, to try to cap what the exposure is on the right, it sounds like 10 grand plus the cost of drugs that you might experience over your, that's the cap.
That's the experience that I had with Florida Blue of being on the Advantage one and going over to the other one. My costs for drugs are lower on the left, and my co-pays for the doctor don't exist on the left, and I'm subject to the donut hole of the drugs on the left-hand side. When I got my first set of drugs on January 2nd, it took $300 worth of drugs to get me to qualify for the minimum. $300 when you got a bone marrow transplant, it's like a sneeze. I mean, the answer is, I got the drugs, and the guy says, it's $312. And I said, well, the paper here says $385. He said, well, the other 85 is picked up by Medicare.
But still, if you're looking for a gross difference,
yes,
your exposure on the right, in other words, you really bomb out,
yes,
no plus 10 grand plus
yes,
drugs. So the real exposure is if he contracts something that requires drugs that are very expensive.
Well, or you don't know you're going to get it, right?
It's the same on both sides. It's the same on both sides because it's not covered here. But what I would say to help clarify your befuddlement is that if you have something really seriously wrong with you, and for your own peace of mind, you want to have it tended to by the best there is, you can do that without hesitation on any plan on the left. You cannot do that without some anguish on the right.
All right, so that is the biggest difference.
That to me is the biggest difference. It's the flexibility.
You're leaving out one of the major.
No, it's not just, it's $10,000 plus you got to get them to agree to cover it. You have to get them to, you've had dealings with your insurer. I've had dealings with them. They're miserable. They're miserable people.
But you're leaving out one of the major differences.
Yes.
It's not only just money, it's where you can go.
No, I agree. That's what I'm saying.
And all these hospitals.
Right. If you want care in what you regard to be the best facility for your ailment, and you want the best doctors in the best facility, you take the plan on the left, because the plan on the right's not going to give you that.
Si, there seems to be some controversy, and that's what this gentleman was talking about the,
Saying that your drug is included in Plan A, and I say.
No, it's not. It's not.
well, wait, hold on.
Only
Hold on.
included in Plan A, and not.
Right.
Hold on just a minute. For that, I pay a certain amount of money. When I said to you that I paid a
Right.
total, the answer is I have an RX drug plan. I'm telling you, the RX drug plan I bought in option 1, the same drug is cheaper in option 1 than it is in option 2.
If you have separate drug Plan A.
It's $10, $12 a month, something like that. It's worth it. Or maybe it's 40. I don't know, whatever it is. But for the condition I have, it doesn't matter.
Sure. Because your drug prices are far more than your
Yeah, the
premium.
drugs are thousands, but
Right.
who cares? If you want to live, you got to take the drugs.
Right. Yes.
Does everybody here have either the left or the right plan?
Of course, you can't. There aren't any others. You either have one.
Is there some way to summarize this and get out of the weeds, because it's just spinning our heads?
Yeah, I agree. I agree. Let me try. All right. We're going to go through the right side now, the Medicare Advantage plans. The number of plans that are available to us this year versus last year has been slightly reduced. If you are already in a plan that you like, you can stay in the plan even though it's not offered by One Exchange. You can still continue in that plan. If you select an HMO or a PPO that does not have drug coverage, you're going to have trouble buying a Medicare Part D plan. So don't take a plan like that. There are two like that I'll tell you about on the next chart. There are no major changes to the cost structure of HMOs. You can get zero premium, relatively low premiums. PPOs, the prices have gone up as you would normally expect, and there are fewer zero premium plans than there were last year. Co-payments are going up, deductibles are going up. You can go on a network in the PPO, but if you do that, it can be very pricey. The HMO Medicare Advantage plans, these plans are the least flexible of all. There is one plan that excludes drug coverage, H1036-063A. Please don't select that plan. If you want to be in a plan with Humana, pick another one, don't pick that one. Copays in these plans don't vary very much. And as I've said every other time I've given this presentation, don't look at copays as the means to decide which plan you want to take. That's the least important. The most important thing is your maximum out-of-pocket exposure. They range from $5,000 to $7,000 a year, exclusive of drugs. Drugs are in addition to this. Your total cost will be heavily influenced by the drugs you take and how often you have to visit a doctor. Your satisfaction in one of these plans will depend very extensively on the office of your primary care physician. If you're happy with that office, if they treat you well, if they don't appear to be in a hurry all the time, if they're not so busy that they're constantly making mistakes with your referrals, you'll like it, and that's fine. Otherwise, if you're in a bad office, you're going to have a bad experience with that plan. If you're eligible for SHAP, you should not enroll in a plan that returns part of your Medicare B premiums. There's a plan, I think, that for this year would return $72 of Part B premiums if you, so not only did it cost $0 a month, it cost minus $72 a month, but you lost your $900 that you could have gotten from SHAP by selecting that plan. So it's Humana, age 1036, 199. Don't take that plan. Okay, PPOs, these are also not very flexible plans. They're somewhat more flexible than HMOs. We have 8 Medicare Advantage PPO plans available to us from one exchange. The premiums range widely from $0 to $147.80 a month. Again, co-pays don't vary very much, so don't look at that as a differentiator. Your out-of-pocket maximums in these plans go from $6,000 to $7,000. If you stay within the network, another $10,000 if you go out of network. Again, your total cost will depend upon how healthy you are, the drugs you take, and how often, if ever, you go out of network. Here, you have to check with your doctors to verify that they will continue in the plan for 2017. The book is always out of date. Whatever the insurer tells you is always out of date. You have to call the doctors. If a doctor is important to you, you must call the doctor and verify that he's still in the plan. Okay, this is the left side of the chart, the Medigap plans. These are the most flexible of all the plans. They're regulated by federal and state laws. Almost every policy in Florida is an issue age-rated policy, which means if you first bought that policy when you were, say, 70 years old, when you become 80 years old, you'll pay a premium that a 70-year-old would pay if he were signing up on that day. So your premiums will remain not fixed. I mean, they'll go up as medical charges go up, but they won't go up because you've gotten older. So if you start a plan at age 70 or age 72, you will continue to pay what a 70 or 72-year-old pays, regardless of what your age is. All policies are labeled by a letter. We've discussed that before. The same letter it's the same coverage across all the insurers for the same letter. AARP, United Healthcare, and Florida Blue will allow you to switch from one plan to another plan. In others, you have to go through underwriting. Having to go through underwriting doesn't mean that you're automatically rejected, but it's a variable that you'd be better off not having to deal with. You get full coverage for domestic travel in these plans, and some plans, the Plan F, for example, they provide coverage for foreign travel. You have to pay the first $250, and then they'll pay 80% of the remainder.
So,
yeah.
does that mean if you get treated
treated overseas, you have to put out first $250?
Yes, you do. The first 250 is on you. If you get treated on a ship, for example, outside of the territorial limit, the first 250 is on you. If you, again, I'm not a travel agent, but I purchase insurance. I'm primarily interested in evacuation, but it also throws in all the other insurance too. So if you get sick, I don't even have to pay the $250. So the insurance will reimburse that. But the main thing is, if you're a healthy individual and you get hit by a truck in Thailand and you need to be treated, you need to be brought to a hospital for long-term treatment, and they have to evacuate you, that's very, very pricey. They need to take up a whole bunch of seats on an airplane. They need to send doctors along with you. Somebody's got to hold an IV. They have to transport you to the airport, transport you from the airport to a hospital. It's $200,000 easy. So buy trip insurance.
Sorry, question.
Yes.
Just for clarification, when you say that they pay 80% after $250?
Yes.
They're paying instead of Medicare paying?
They are Medicare. This is your Plan F.
This is Plan F, which is a Medicare.
Yes, right. I'm sorry. Yes, the insurer is paying it. You're right.
The insurance rate is not Medicare.
Well,
Medicare is out of country.
yes, the insurer pays. The insurer pays this. So what you have to do is you would have to provide bills and request reimbursement from the insurer. Okay. Are any of you, becoming Medicare eligible for the first time in 2017? Okay, so are any of you coming off a group plan this year? And all right, so you don't have to worry too much about this, so we'll go quickly. If you're in one of those situations, you have an opportunity to take a Medicare Advantage plan, a Medigap plan, without any the issuance of that plan is guaranteed, that you cannot be rejected for a Medigap plan because of any pre-existing conditions that you might have. Medicare Advantage plans are by law always guaranteed issue. So you can never be rejected for a Medicare Advantage plan, regardless of pre-existing conditions. But you can, except for certain times, be rejected for a Medigap plan. Okay, here is what they pay. We look at F. F pays 100% of everything, 80% of foreign travel after the first $250. Plan C is very, very similar, just one little change to Plan F. Plan N is another decent plan. Again, a few little changes from Plan F, but that's basically what you're looking at. These plans have out-of-pocket limits before they kick in.
Sorry.
Yeah.
The only difference between F and F star is the deductible.
Yes. It's $2,200 in 2017. That's the only difference. The premium is lower, and I'll show you an example later. Okay, so Plan F, as we just heard, it comes in a version that's called a high deductible Plan F, has the same coverages, but the first $2,200 is on you. Okay, so here's an example. We'll compare Florida Blue Plan F and the Humana High Deductible Plan F. So this is the premium for me for 2017. This is what I would pay for the high deductible plan from Humana. That's the annual charge. If I never got sick a day, if I never had to see a doctor, if I never needed physical therapy, if I had a really great year, I would save $1,800 a year with the high deductible Plan F. So that's a good thing. If I got really sick, if I got really sick, my health deteriorated, then I would pay only $318 a year more for having the high deductible Plan F than I would for the regular Plan F. So if cost is of significant concern to you and your health is reasonably good, you could take the high deductible plan, because the worst that could happen to you is that you will have overpaid by $300 if you got really, really sick. So hey, that's the high deductible is a good alternative. Now, me, I can generally come to that deductible within the first 7-8 months of the year. So I take the regular Plan F. But if you're in good health, you consider the high deductible plan. It's fine. And there's no really large penalty if your health deteriorates.
Except for filling out the form.
Yes, you have to fill out the forms for the $2,200. Okay. So here's another comparison. It's the same Plan F. And now we're looking at a Cigna Plan N. It's a $60 a month difference. It's $700.13 a year that you'll save with the Plan N. So if you don't have any emergency room visits, if your doctor visits are less than 36 a year, it's not just doctor, it's physical therapy sessions, it's all of those things carry copays. You have to pay copays here. So if you'll satisfy these conditions financially, and if you don't like if you don't mind filling out forms, Plan N is a perfectly good plan for you. Again, we mentioned earlier that AARP, United Healthcare, and Florida Blue will allow you to switch back and forth between their, well, I shouldn't say back and forth, will allow you to switch between their plans without going through underwriting.
There's your answer, Morris.
That's not always the case though, right? In the beginning, that wasn't the case, right? When we first did this, like when I first went on Medicare, that was not the case.
Okay, what was not the case? I mean, switching back and forth?
Yeah, without going through underwriting.
It probably was, it's, even today, it's not the case with most insurers. With 2 insurers, you're allowed to do that. You're allowed to do that with United Healthcare and Florida Blue. You can't do it with Humana, for example, at least not yet. Okay, prescription plan, you're going to pay more in 2017. You've read about these outrageous increases in the cost for EpiPens, and that unfortunately will continue. The deductible's gone up from $360 to $400. If you're taking a Medicare supplement plan, a Medigap plan, you have to enroll in a prescription drug plan. There is a really good way to do that. I've printed out, there's probably 50 pages there, but the instructions are just on one page, so there's enough copies for all of you. But if you go on the government www.medicare.gov website, you enter in your drugs one at a time. When you're finished, you'll get an ordered list of all of the drug plans available in your zip code, from the cheapest to the most expensive. Okay. This is, you don't have to copy this down. This is the form I give you. I even give you my phone number and my email address if you have questions, but it's a fairly easy way to pick a drug plan. I had a Humana plan for 2016, and I switched to a SilverScript plan for 2017. It's cheaper, and there are very few companies I can think of that are more difficult to deal with from a customer service standpoint than Humana. So I'm happy to be able to rid myself of the experience. Okay. We're sort of coming to wrap up time now, but again, if you, in terms of guiding you towards a plan, if you have minor health issues, you have relatively low prescription drug costs, you have a lot of choices. There are a lot of things you can do. The lowest cost are HMOs, but they are definitely the most restrictive. Within HMOs, Humana Gold seems to be a pretty popular alternative with our members, with friends of mine. But your happiness with a plan like that will depend largely on the office that you deal with. If the office is, if they're not harried, if they have time to deal with you and treat you civilly, you'll like it. If not, you won't like it. There are PPOs available to us that have zero or very low premiums. However, if flexibility is a key consideration for you, you really should think in terms of a Medicare supplement plan rather than a Medicare Advantage plan. And the Plan F, with the $2,200 deductible, the high deductible Plan F, it's a good alternative, very good alternative for healthy individuals. If you have moderate health issues, you shouldn't consider HMOs at all unless cost is of paramount concern to you. So if you have to be cost driven and you have health issues, you think of HMOs. Otherwise, PPOs offer you a little bit more flexibility at very little extra in the way of cost. Again, if you require full flexibility, you want to be able to go to any doctor in any facility, then you should consider a Medigap plan. Plan F is my favorite, but Plan N is good. High deductible Plan F is good. But Medigap plans are the way you should go if flexibility is important to you. Okay. If you have high health issues, if you have major health issues, then you should be in a Medigap plan. CF, they provide the highest flexibility and in many instances might even provide the highest cost in terms of limiting your out-of-pocket expenses. If your out-of-pocket expenses in a Medicare Advantage plan are going to approach $4,000 a year, you may very well be better off financially in a Medigap plan. So you ought to think about that. If your expenses are only a few $100s a year, $2,000, $1,000 a year, financially you're obviously better off where you are in a Medicare Advantage plan. But if you're approaching 4,000, you should try to move to the other end of the scale while you're still able to do that. Okay. Dental. We have 5 options available to us. The only option that covers serious things is the MetLife option 2. It's the most expensive plan, but if you probably don't need a plan if all you need in the way of dental care are 2 cleanings a year. And you can have a plan or not have a plan, but they'll all provide that. But if you have serious dental issues, if you perhaps need an implant, if you need crowns, if the only one that deals with serious issues is the MetLife option 2. But by the way, in this area, there are at least 3,000 dental providers that are part of this MetLife network. So it's a preferred provider organization. There's a $1,500 cap per year, so that's the maximum amount they're going to pay no matter what shape you're in. However, even if you exceed the cap, you're still entitled to their contracted fees for service with all of the providers. And those contracted fees are often at least 30 or 40% less than what you would be charged if you went on your own. Okay, the vision plan, I say this every year, go to Costco. Don't pay the $150 because it's hardly worth it, because anything you want in the way of extras, if you need progressive lenses, if you want UV tilt, if you want polycarbonate lightweight lenses, all of these are extra charges, extra, so that by the time you're done, the free glasses that you thought you were getting will cost you $200 in addition to the premium that you pay. So go to Costco. I mean, you'll get glasses that automatically come with everything on it. There's no way not to get it with scratch-resistant coatings and UV. it comes with everything you could think of, and it's very competitively priced. Okay. If you're new to Medicare and OneExchange, you can enroll, husband and wife can enroll in different plans. However, the downside is that you each have to enroll, that you have to schedule 2 telephone conversations with OneExchange. And the quality of that conversation will largely depend on the competence of the person you're speaking with, and that varies tremendously. You've all had the experience, so you know what I'm talking about, is that sometimes you get somebody who's competent and knows what they're doing, but it's best that you prepare ahead of time so that you can lead them in the discussion rather than allow them to lead you. So the more prep work you do, the better off you are. If you're satisfied with your current plan, you don't have to do anything. You can just, if you want to stand pat, you don't have to contact one of you. You can just, everything will continue. The premiums will change, but everything will continue just like it did, just like you had it this year. If you're currently in a Medigap plan, your options to change would be limited, except as I mentioned in the case of United Healthcare and Florida Blue, you can change within those families. If you want to cross families, you may have to go through underwriting. Yes.
In general, how long does it take to do that?
I don't know, Judd, you would know better than me. I would say about a month would be my guess. Is that about?
That's about right.
Yeah. I think to get a final determination would take a month. And if you wanted to do it kind of at this time of year when they're busiest, it may take longer. But I think it usually takes a month.
I wouldn't try to change right now.
Yeah, I agree with that. Yeah, if underwriting will, I mean, you could try to approach it, and if they're willing to make a change without underwriting, that's easy.
You can do it anytime.
You could do it anytime, yeah.
With a medical versions, probably not that big a deal.
Yeah, I agree.
If you're going from an advantage
to Medigap, it is. I mean, yeah, I think Greg was really very fortunate because that's usually not easy with pre-existing conditions. It's usually very difficult. But I guess in his case, what Blue Cross was weighing in their minds was how much they were going to have to pay for him as a Medicare Advantage patient versus how much they would have to pay for him as a Medigap patient, and if that could be compensated for by the difference in premiums that they would charge him. So to them, it was an economic decision. But if he were coming from another company, I think they would have turned him down.
You're not making any changes, you're staying the same.
Yeah, you don't have to.
Well, OneExchange.
No, you don't. Okay. You have to recognize that this is important. I mean, I mean, okay, yeah, maybe I'll be a little insulted if you don't feel it's important, but this, you have to recognize that it's important and you shouldn't slough it off. If going on the Medicare.gov website is difficult for you, if you don't feel you know how to handle computers, your grandchildren can do this for you without breaking a sweat. The main thing is, don't be lazy. You have to check things out. You have to check out whether the doctors that you really want to remain with are still in the plan that you want to select, if it's in the case of a Medicare Advantage plan. You have to check out whether the drugs that you take are still in the formulary of the drug plan that you select, and that those formulary entries don't have any footnotes that can come back and bite you later on. Don't automatically assume. I've heard conversations in this room in prior years amongst people saying, oh, I'm going to pick that AARP plan because it's AARP is good for seniors. And there's no AARP insurance company. The insurance company is United Healthcare. AARP sells their name to the highest bidder. In this case, for health insurance, it's United Healthcare. For automobile insurance, it's Hartford. But their name is sold to the highest bidder, not the best provider. Typically, United Healthcare ranks sort of in the middle. In prior years, I would have said that they rank low, but they've gotten a little bit better. Aetna, Humana, Florida Blue rank higher than United Healthcare. So I'm not discouraging you from picking United Healthcare. I'm merely telling you, don't automatically assume because you see the name that they're great for seniors, because that's not the company you deal with. The company is United Healthcare. Again, on the bottom, don't assume that your providers are still in the plan. The gentleman mentioned earlier about how Humana had notified its customers that the Boca Raton Regional Medical Center is no longer part of their plan. Now, this is, in many instances, it's a game that's played between insurers and providers every year. Boca Region, well, then it was called Boca Raton Hospital, was out of favor with Blue Cross Blue Shield about 15 years ago. These issues are usually resolved, but it's not guaranteed. And there are always issues over payment, just payment for services. Okay, we got some Q&A that I'll start with, and then if any of you have questions, I'm here. I'll be milling about the room as long as Ruggle will remain, and you could collar me one-on-one if you like, but okay. Question one. I'm enrolled in a plan on my own. Can I get the HRA if I enroll in a vision or dental plan through OneExchange? No, because you have to enroll in at least one prescription drug or medical plan in order to get access to your HRA from OneExchange. If you enroll in a dental plan through them, that's great, but it's not a sufficient condition for getting access to your HRA. It has to be at least one medical or prescription drug plan. Okay, if you and your spouse are both eligible, can you use the other's HRA? Yeah, if you have a joint account, you can do that. If you set it up as two individual accounts, you can't do that. So again, unless you really hate each other, keep it as a joint account. What's creditable coverage? Okay, Judd just showed me a list. It's a complex word that all it means is that the coverage that's provided to you by IBM, by an insurance company, is at least equal to or superior than what Medicare offers in their Part D prescription plans. What happens if I don't sign up for a plan? You get penalized. So every month of delay, it's going to cost you 1% more. So if you delay for a year, your premiums are going to be 12% higher the following year. So even if you take almost no drugs, sign up for the cheapest plan, because if you don't sign up, you'll be penalized when you have to sign up. Okay, SHAP. If you retired on or before December 31st, 96, you can be reimbursed for up to 80% of your Medicare Part B premiums, provided that you are not otherwise reimbursed for those same premiums. You fill out a form, a simple form, which you can mail or fax to a company called Acclaris, ACCLARIS, and you can do it quarterly, which is how I do it. Some people do it annually. Some people do it monthly. I do it quarterly. I think quarterly is probably the most frequently you can go. And you don't have to provide them any Medicare information. They know that. They know what you paid. You just fill out the form and you'll get 80% back of what you paid, up to $900. Yes?
I think I got one of those forms around. If I can't find it, I would need exactly to know how to contact who.
Okay. www.acclaris.com.
Spell Claris again, please.
ACCLARIS.
Thank you.
You're welcome. And every time you fill out a form, they send you a form. So when you send it in or you fax it in, when your check comes, it includes a form for the next time.
Sorry?
Yes.
I'm lazy, like you, I don't like paperwork. I find it easy to, in February of 2017, fill it out for a whole year for 2016.
Yeah, that's fine.
A one-time deal.
You can do that.
Oh, you have
Yeah.
till March, that's it.
They extended that for the first time in 2017. I actually believe that you now have all of 2017 before you have to submit for 2016. But then it begs the question, why would you want to? Because they're holding your money. So the sooner you go for it, the better. 1 year plus current. Okay. If you're in a Medicare Advantage plan, you can't have a Medigap policy also. You go one way or the other. It's for that reason that if you're in a Medicare Advantage plan, just also make sure it's one that offers drug coverage, because it's difficult to get drug coverage separately if you're in a Medicare Advantage plan. Okay. Oh, there it is. There's the answer, Acclaris. I'm sorry, it's Acclaris Online. But you would have gotten there with Acclaris. It would have told you. Again, if you retired, before 90 or before 96, which is when I retired, 80% of the Part B premiums, $900 maximum per IBMer per year. Okay, any questions?
Sorry, I got a question.
Yes.
And this might, anyone here can help with this. The payment automatically for the medical and the prescription is no problem. The reimbursements come in, no problem. Trying to get reimbursement for the dental seemed to be a complicated procedure.
Who is your dental?
Dental Humana, PPO.
Okay.
And you had to get some form that to show you were covered. I ran out of patience trying to do it. Could you address that?
Okay, there's not much I can do to help you with Humana other than tell you that I commiserate with you and that their customer service is poor. My plan is MetLife. And in MetLife, you don't have to get reimbursed for anything. What happens is that the dentist bills you the contracted rates, and the dentist submits the bill to MetLife. MetLife pays their share, which is typically 50%, and then the dentist bills you directly for the part that MetLife didn't pay, and you pay the dentist. So there's no reimbursement requests that are necessary.
I'm talking about the reimbursement for the insurance premium.
Oh, okay. So you're not getting that from One Exchange.
It was complicated to sign up for it. It wasn't as easy and automatic as it was for the medical and a prescription. You had to go through a couple of hoops.
Well, what's your medical plan? What medical plan are you in?
I have Humana PPO for dental.
Oh, no, I'm not talking about the dental. I'm asking what.
Medigap plan F.
Okay, so doesn't your payments for that cover, the $3,000?
I don't know, it's automatic. It's taken out of my account and the reimbursement goes into the account.
Okay, but, all right.
No problem with the prescription and the medical. The dental is a complication.
Well, I'm saying that it's a complication only if you want to make it that, because I'm sure that your $3,000 HRA is fully exhausted by your Plan F premium and your...
Oh, that's true. It's $3,500.
Well, when did you retire?
88.
All right, so for you it's 35. For me it's 3,000, but it's fully exhausted by the
So that doesn't matter.
it doesn't matter. Right. Okay.
Sorry, I used up my HRA $3,000. Do my wife have to go through One Exchange for medical coverage?
Yes. Unless you're in a special class of a veteran. If you are a veteran, you can obtain medical coverage through the VA and not have to go through them. But otherwise, if you want to access the money, you have to go through them.
Yeah, but like I say, I used up myself more than $3,000. I mean, I used up $3,000 myself by my premium.
Right.
So what's the advantage for my wife to go through it?
Oh, you said for your wife.
Right.
None. She can go through them, or she can go independently.
Go outside.
Yes, she can.
She doesn't have to go through.
Right. The only advantage conceivably would be that you would get your $3,000 reimbursed sooner.
Okay, sure.
Right. Yes.
Side. Of course, we signed up 3 years ago for an N plan.
Yes.
Medigap. And as you mentioned earlier, as you age, the premium doesn't change because of that you age.
Yes.
If you switch from an N plan to an F plan, does the age difference affect that?
Okay, the honest answer is I don't know, but I would guess that if you stay within the same carrier, it probably doesn't affect it.
Okay, and if you go from an Advantage or the other way, from an N plan, Medigap plan to an Advantage plan,
if you go from
same carrier,
if you go from a Medigap plan to an Advantage plans are age rated, so you save nothing in that regard. The only thing that is issue age rated are Medigap plans in Florida.
Okay.
Yes.
When you go out of network on an Advantage plan, do you have to pay the amount yourself and get reimbursed, or do they pay it?
You pay it, and you get reimbursed.
You have to go after them for the reimbursement?
Yes.
Okay, thank you.
Maybe you could make, maybe in the case of serious illnesses where you've had multiple conversations with your provider, there may be a different way to do it. You may be able to get, if you're going out of network to a new doctor, you may be able to get that doctor to bill your insurer. That would make your life easier. But usually, you kind of have to pay it. Usually that's the case. And if you have to pay it yourself, you need some, well, I guess Medicare will still determine the allowable amount for the procedure, right? Assuming we're talking about someone who's Medicare eligible. Okay. So you would know the right amount that has to be paid. Yes.
I think so, if you ask me.
Situation.
Right.
In those cases, this is the ARP, the way that they're structured is the copayment goes from $50 to $70 for out-of-network doctors. The payment for the procedure goes from like 40% to 60%. And that's still routed through the insurance company. In other words, it doesn't matter whether you're going out of network or in network for the PCO, at least in United. You still submit, the doctor still submits it to United, and you still get from United a basic percentage that you don't.
Right.
So as far as the provider is concerned, he's just saying, I'm not accepting this insurance company, but I'll still go.
Right.
Yeah. You pay them full, but the provider will never pay anything.
Yeah, so if your provider is contractually linked to your insurer, then I think you're okay. But if he isn't, then I think, they won't want to deal with them. Like I said, my primary doctor.
They dropped to that.
Right.
So
okay.
The question is, how does my wife go to that doctor which she really needs, and how do we pay them?
Yeah. One thing I would mention is that you often hear phrases like Humana dropped them, referring to a medical practice. That is rarely the case. It's not that it doesn't happen, but 90% of the time it's the other way. It's the practice itself deciding that they just can't make a living dealing with Humana or whatever other, and they drop the insurer. Greg.
Quick question, Si.
Joy, yes.
Can I come up and get the form with the information for the plan, the prescription plan? You had some information you said?
Right here.
Okay, thank you.
I only put it there so that you'd have to come up for it. Any other questions? Yes.
Will your presentation be online?
I'll answer that, yes. It's on the website. We're taping it. We're doing it right now with Google. So you'll be able to see all the charts very clearly.
Yep. Your chart about income versus some of them.
Yeah. Sorry. It's going to be online at the website, IBM website. Well, I guess y'all are done, huh?
Yeah. I am paying this premium because
sure looks like that.
My wife turned 65 and they are
okay.
charging me the same.
Thank you to Si. Yeah. There's where the patience lies with Si to get this stuff all done. If there's no further questions or any comments.
Other thing is,
we're a little light on the comments, so bring the green sheets over there, please.
And prescription drug.
Sure.
Join United.
I'm Angelo Gaspari. As of next week, actually the beginning of the year, I'll be the only officer left on the board. You need to help me prevent a serious health situation here. I will either go crazy or I'll start drinking. Please volunteer for the board.
Okay, one lighter in the corners. One last piece. See them over there in the corner, the brown ones. So recycling goes on the top. Would ask you to clean up on the floor, please, with some of the stuff that you got. Thank you. Goodbye. Good night. Oh, now there's another one. Eat the cookies so Angelo doesn't eat them. Thank you.
Hey, Sid, how are you?
We got your prescription.